This meeting was organized by the Romanian Society of Endocrinology and AACE chapter of Romania. AACE stands for the American Association of Clinical Endocrinologists. It is a relatively new endocrine organization in North America and USA. It is about 28 years old, but it has affiliates and chapters in many international countries. And one is Romania, where the members are very active, and they annually organize the meeting in association and in affiliation with the mother organization in the US. AACE was developed 28 years ago with a vision of bringing endocrinologists and clinical endocrinology together, and it has been very successful. We have 8,000 members. The vision is to promote clinical endocrinology and to promote and improve endocrine care in both US as well as worldwide. The main topics here has been multiple and very interesting. The Congress is covering state-of-the-art areas in endocrinology. One is molecular markers, another one is the effect of iodine in thyroid cancer, another one is management of patients with small thyroid cancer, another is area of endocrine and neuroendocrine tumors. Overall, I would say that the science quality is excellent, and faculty and speakers are outstanding. One of the areas of considerable interest and controversy is molecular markers and application and its use in endocrinology. In particular, in thyroid practice, molecular markers have found very useful. Molecular markers are applied for diagnostic purposes to thyroid nodules and goiters. Molecular markers are of use in prognostic factors and prognostication of thyroid tumors. And molecular markers have been developed and are very reliable in identifying certain types of thyroid cancers, such as medullary thyroid carcinoma. So molecular markers are developing, and they are in a state of evolution. Personalized medicine is coming to endocrinology. I don't think that it is for prime time yet, but most certainly in the next 5 years we will see personalized medicine. And what do I mean by that? I mean that when a patient presents to a physician or an endocrinologist with a certain type of thyroid tumor, we can identify the molecular structure and characteristics of the tumor, and then we can treat that patient specifically with that abnormality. Not only the patient, but the family and also affiliated members can be evaluated and treated. So we are looking for the next few years to focus our treatment and plan for management based on molecular markers. What is aggressive disease, what is relatively innocuous disease, and then to manage each patient according to an individualized plan. For endocrinology, I think that the challenges are both in diagnostic and in therapeutic programs. But I would say at the moment, probably management and treatment provides more challenge. There are many different options for treatment, and to choose among them what is best for a given patient and a set of disorders is a challenge. I think the Romanian patient can be assured that the Romanian Society of Endocrinology and Romanian physicians are up to date in these areas. So for patients it's reassuring to know that his or her physician is knowledgeable, is up to date, and can offer the best available treatment and information. I think for physicians, I would say that this meeting and similar meetings are educational, informative, and bring home to them the science that is needed for their education and for treatment of patients. So I would say that this meeting, for many physicians, it may not be possible to travel to US or to Western Europe or other distant places, but this meeting brings expertise and faculty to serve Romanian physicians and science. So I would say, I would make the following observation. Number one, English is very good. The command of language is very important. So the presentations are fluent in English and understandable, and slides are very good. The science is very good. They present areas of science that is interesting, challenging, and also well developed. Speakers have for most part, high quality speakers, and they have chosen areas and topics that are both hot and of interest to general audiences. And so I would say that this meeting is a very successful meeting in terms of bringing physicians together and distributing new information to physicians who will go to their clinics and to their practices next week. So I would say that if I compare the endocrinology in Romania to US, I would say there are many similarities. In fact, there are more similarities than differences. Yes, perhaps we have more access to more testing and diagnostic centers. We may have more access to newer tests, but those tests are coming here and they are available. And even if they're not available inside Romania, they can be ordered and become useful for patients who are here, and these services can be obtained from outside. So I would say that Romanian physicians are doing their best with limitations. They are doing their best, and I am very pleased and very optimistic.